Rick, why are you picking on Papa John's?
Listen, I think he's got it coming. Here's the problem. All of these restaurant chains are trying to find a way to avoid the new healthcare law, Obamacare. And the way they're doing it is by cutting down the hours of people who work for them so that they will earn under the 30 hours, which is what it requires to be a full-time employee for purposes of the law. It disturbs me greatly. Set aside all of the liberal reasons I might give you, the heartfelt whatever, set that aside. Here's my problem. These people work for Papa John's. Papa John's is profiting off of their work. Fine. The problem is that when he denies them health care, I say he, it's the gentleman who runs the entire company. You know who's paying for that? You and me. We're paying for it because we both have health insurance. When these people who, by the way, make too much money to have Medicaid, they make too little money to be able to afford to go out and buy health insurance for their family. So what happens when they get sick? They end up in the emergency room, even for the most basic of care, and you and I pay for that. We pay for that in our monthly premiums on our health insurance. It's passed along from the hospital to the insurance companies. How is that free enterprise? How does that make sense that Papa John is getting the benefit of their labor? His refusing to pay for their health insurance drops to his bottom line. I'm subsidizing his profits when I pay for their health care, and I don't shop in his restaurants.
Well, I think this is all very predictable, and I just go back to, even before Obamacare, which you and I disagree on vehemently, whether it's good or bad. But let's put that aside. Even before Obamacare, what we saw companies do because of healthcare laws and healthcare insurance, they were trying to get around having to pay that, so they would reduce the number of hours, because once you got to so many hours, then they had to be considered a full-time employee and you had to pick up insurance. So when there's an additional cost, regardless of how it comes about, companies are going to try to get around that extra cost.
But it's irresponsible.
I don't think that makes them evil people. Here's why. Because when costs go up, you're going to have to do one of two things. You're going to have to raise prices, or you're going to have to find other ways to lower costs. Otherwise, you're not going to stay in business. That's
totally
a basic
legitimate.
fact of economics.
Totally legitimate.
And if you're a public company, as powerful as you may think you are, they don't answer to you. They have to answer to the shareholders.
I agree, but here's my problem. I buy what you're saying completely. But you know what? When the price of dough goes up, Papa John's raises their prices. When the price of tomato sauce goes up, they raise their prices. I get that. That's the way it works. But guess what? They have an obligation to their workers. And yes, that will raise their price. In the case of Papa John's, actually, he was telling us it was 14 cents a pizza. A terrific reporter right here at Forbes, Caleb, did a phenomenal piece where he did the math, the hard cold math, and showed that in fact it was closer to 4 cents a pizza.
Here's where your logic's wrong. You can't hire part-time dough. You
can't
hire a part-time employee.
But how can it be, and I'm not saying he's an evil person. I don't know this guy. He may be a wonderful guy. But how in the world does he justify me making this contribution to his bottom line? Look,
he's giving you the choice. You don't have to go. And he's not alone.
No, he's not giving me the choice. That's my problem.
Don't buy his pizza.
That's my problem. I don't buy his pizza as it happens. I'm sure his pizza's fine. I don't buy it. And I am still contributing to his bottom line. That's precisely my point.
There was a very easy way to get around this, which was for however many people, and you see different numbers, however many people don't get insurance and that go to the hospitals and we all contribute, could have just as easily started a fund just for them.
Well, here's the thing. That's fine,
bigger.
Except it would have been a public.
And I just want to throw this at you, and I'll leave you with the last word because it was your post. Dana Corp, which is an Ohio-based auto parts company, they've cited Obamacare as why they're doing layoffs. Microsoft, huge company, tech company, not thought of as like this manual labor driven. They've said they're not going to hire because of this. And a whole host of medical equipment companies. So it's not just poor Papa John's, it's all these companies,
Here's
Rick.
the problem. I don't believe that that's the reason. I know that some of them are saying it. Microsoft has been giving insurance to their employees from day one. So I don't buy that. I think there's some reasons that Microsoft may not be hiring, but that's the topic of another conversation. Look, I didn't invent the American healthcare system. Had I invented it, I would have done it very differently. I don't think the way we structure it is necessarily the best. I don't agree that the entire system should be built around employer benefits. But yet that is the way that it was done. And it wasn't my party who went into this discussion saying, let's keep it that way. It was in fact the other party who wanted to continue private insurance model and running it through these big company employers. Okay, fine, that's what we've got. Now what you're suggesting, I would have been perfectly good with. If we could have taken the people that you just referenced and put them into a public option, could not agree with you more. And yet, we don't have a public option. And why don't we have a public option? We don't have it because the Republican Party refused to even consider it. It would have absolutely been the smartest way around it. By the same token, if you ask me, the best way to handle all of this is take it totally out of the employment realm.
We don't have a public option because, number one, when the president controlled both the Senate and Congress and he ran through
You mean for those
Obamacare
43 days?
and he wrote it completely and handed it all over to Nancy Pelosi, he was pushing towards nationalized medicine. That's his goal, no doubt.
Actually, it's not.
And doing that would have not allowed him to move it towards nationalized medicine.
I will tell you, it's my goal. It's not Obama's goal. It really isn't. I actually think we'd all be much better off. I know you don't agree with that. I don't think we should be doing it the way we're doing it. It's inefficient. We have precisely the kind of problem that we're sitting here talking about. Take the employers off the hook. I'm okay with that. Completely okay with that. I think it will cost business less money if we were to nationalize the system. Had this conversation often. They actually agree, but you know what their fear is? Is that the tax, like most taxes, admittedly, will creep up over the years and will get to the point where they were better off before. I don't necessarily agree with that. I get their concern. Take it out of there completely. Nationalize the system. We should have had a public option for the people you are talking about. That would have been the right way.